Welcome to the last unit of Diet 111, Nutrition Through the Lifespan. We'll begin by talking about pregnancy, and as part of this we need to look at infant and maternal health in this country. You can explore that at the Community Health Explorer, and I would ask you to do so. Go on here and play around for a few minutes. Be sure to pull down the drop-down menu to maternal and infant health and check it out from a few different perspectives. Although these statistics are a bit older, they clearly show a pattern which is not a good pattern, and that is that the United States is not faring as well in terms of infant mortality. Maternal mortality also is falling short of targets, so we need to consider why. We also need to consider why there are such disparities, racial disparities in this area. So nutrition is important, but nutrition is not the only factor that has an impact. Our healthcare system, poverty, substance abuse, the list goes on and on. But we, of course, will focus in on nutrition and the importance of nutrition during pregnancy and lactation. And it is easy to imagine that this totally dependent developing being requires certain nutrients to grow, and that's what we see. It's an amazing change that occurs from zygote to embryo to fetus. Totally amazing and very dependent upon the nutrition intake of the mother. So what are the goals around good nutrition during pregnancy? The goals would be that stores are adequate and habits are sound. So actually preparation for pregnancy should begin well before pregnancy. Ideally, what should be happening in this country is that young girls should grow up into healthy young teenagers, should grow into healthy young women with good eating habits. If that happened, then nutrient stores would be adequate and habits would only need a little bit of tweaking. The other thing we'd like to see is that weight is healthy and that the nutrients that are part of that daily diet, as I mentioned, are adequate, because that will help grow a healthy placenta, which then is important to the development throughout the pregnancy. In class, we would talk about this. What do you feel is most important for newly pregnant women to know? And quite often, students are fairly aware of this. They talk about things like getting enough iron, getting enough rest, drinking enough fluid, eating a healthy diet, and all of those things are very important. Weight becomes a crucial issue, and in the past our focus was on low birth weight. Low birth weight babies are at a greater risk for disease and early death. They are very much a concern. The causes are many and can include poor nutrition, but can also include things like heredity and diseases and smoking and substance abuse. Now we have a newer problem, and that is overweight or obese babies, something I'd never thought I would say years ago. It was unimaginable 30 years ago that we would ever consider obesity in infants, but now we're seeing this. We're seeing this because of diets from the mother that are very high in calories, overgain of weight during pregnancy, and also diets, of course, that are extremely high in sugar and could possibly increase blood sugar and trigger diabetes. This is an issue. Babies are always cute, by the way. In class, I have students that say, "Oh, but that baby's so cute." True, but these babies are set up for more health problems, and that's a concern. There are greater issues around the delivery, but also a greater risk of fetal death and a greater risk that that baby will continue to be overweight and obese throughout life. The mothers who overgain are more likely to struggle with losing that weight and having all of the problems that come along with obesity. Please, please, please watch this video because it describes this problem and has some interviews with some women who are or were pregnant. But it's shifted the conversation and become really one of the most important issues health-wise around pregnancy. Instead of urging enough weight gain, we now, for many, many women, are stressing how important it is that they do not overgain. So for your test, you do need to understand the total weight gain based on BMI for each of these different categories. And I will tell you, for most women, staying within these ranges takes a lot of work, a lot of being aware, a lot of tweaking their diet, because we are living in an obesogenic environment. This now is difficult. Most women cannot simply eat whatever they feel like and be fine. Women who do that tend to gain far more than the 25 or so pounds recommended to 45, 55, 60 pounds or so. And this sets up health problems for both the mom and her baby. It's also important to understand, because some women are overly concerned about weight gain, that there's a reason for it. And for women who gain in the recommended range, this weight is all accounted for, and the amount of fat that's gained is very low and can be lost for most women without too much of a problem. This slide's important, and you'll see a couple of test questions on this slide because the pattern of weight gain is crucial to understand. During the first 3 months, the total weight for the entire 3 months is only a few pounds. And then after that, about a pound per week. What I've seen happen many, many times over is that because of stress and anxiety and celebration, women early on gain 20 or so pounds. Again, for the entire first 3 months, the ideal gain is only from 2 to 4, and then a pound after that. Women who overgain should not be recommended to lose weight, but you may need to bring that weight gain under control and take a good look at the diet. And also, women who don't gain enough should be referred to a doctor to check that everything is okay, but then also we should look at the diet and make sure they're getting what they need. So these charts are quite important. I'm going to stress a few things, but read over them very, very carefully. I think every section has a presentation on this as well. When we look at the nutrient needs of pregnancy, there's a lot of nutrients in few calories, so let's start there. First trimester, the extra calories a pregnant woman needs are 0, none, nada, okay? And then the second trimester, 340 above non-pregnant levels. So if the woman required 2,000 calories before pregnancy, she would require 2,340 in the second trimester, 2,452 in the third trimester. So what this means is it's only 300 or 400 extra calories, which is close to nothing. A snack, okay, a healthy snack of a small sandwich, an apple, and a milk, you're done. The idea that pregnancy is this time to just eat, to abandon, to just eat whatever you want, sundaes, chips, cheeseburgers, cheese fries, you only get an extra few hundred calories. And in those calories, you need to also obtain the extra nutrients required. Most of us are set up fairly well for the protein. You'll see that in the case critical thinking presentation as well. Most of us consume more than 25 grams above our needs already, but we also need more fiber, more healthy fats, a little bit more water, and then quite a bit, look at pregnant compared to non-pregnant, quite a bit of many of the vitamins. Take a look and be sure to read. I want to bring something to your attention. Look at calcium. Now, you might imagine that calcium needs would increase. Of course, why not? A skeleton is being built. But what happens is the mother absorbs much more calcium. And then when the calcium is required for calcifying that skeleton, it's drawn from her bones. So the bioavailability of calcium increases in the mother. Healthy foods across the array of food groups, not that much more though. And this is really important, and why at the bottom of your screen I listed a non-pregnant healthy My Plate diet. So you can see, well, that pregnant woman really does not need any more than the 2 cups of fruit. Only a bit, about an extra cup of the vegetables, very little extra of the grains, another serving or two, which is only an ounce, remember, and then very little extra from the protein group, nothing extra from the dairy group. So imagine in your brain for a minute what most people think of a pregnancy diet. Doubling up, eating for 2. This is absolutely not the case. You need to eat healthy when pregnant, but not double. Now, to back up the diet, most doctors recommend a prenatal supplement. But keep in mind that this supplement does not provide all the nutrients required. It's got a good lineup of vitamins and minerals, and it will fill in some of those gaps, but that healthy diet is still required. Physical activity is recommended with some cautions. When I first began teaching this class, I was surprised in that a lot of individuals I talked to believe that pregnant women should simply sit and rest, especially if they worked all day. But exercise is really important to stay healthy and also to stay fit. And staying fit or becoming a bit more fit actually decreases the time of labor and improves or shortens the time to bounce back after the delivery. So I would ask you, because there's a test question, to be sure to look at the little video on WIC and understand what this very important program is. It is a safety net program. It doesn't provide all of the foods required by pregnant women, infants, and young children, but it provides some of the important ones. And the lineup of foods allowed has changed recently. So they eliminated baby juice, for instance, and we'll look at why that is. They cut back on milk because a lot of women complained about having too much milk. Some of the problems during pregnancy. This is a fantastic little video clip. Please watch it. You may see a test question on gestational diabetes. I'm going to leave it at that. Very, very important to understand gestational diabetes. You must watch this video. Important for us to watch hypertensive disorders of pregnancy. So be sure to read up on that as well. When blood pressure becomes very high very quickly, that can signal something much more serious. Other nutrition-related concerns include things like cravings and aversions, your taste and your smell changes during pregnancy, along with all the emotions that batter the pregnant women, and this can lead to cravings. Doesn't need to be a nutritional problem, but can be. So some women may have to get a little bit of hold of this. Morning sickness can occur at any time. It describes the nausea that can come due to the hormonal changes. So the queasiness can be slight or it can be quite serious. One of the things they recommend for morning sickness are dry foods like toast or crackers, and they've shown that ginger, not ginger ale, but real ginger is helpful to quell that nausea. Pica is not uncommon with pregnant women, and these are cravings for non-food substances or food substances in unusual amounts. Pica would include something like cornstarch, which some pregnant women crave and eat by the spoonful. Pica would also include some more dangerous substances such as laundry starch or clay or soil, so this needs to be evaluated as well. Heartburn and constipation are common. The hormones of pregnancy relax the muscles and sphincters of the GI tract, which would explain both, and the crowding of that fetus becomes an issue as well. Some things that you should not engage in: smoking is a problem in pregnancy. I've got two good links if you've heard otherwise, because there are some weird urban legends floating around occasionally. Smoking is harmful, and many pregnant women can quit due to changes in taste, or also because it's about more than them. We want them to stop smoking and then to not start after they deliver. Alcohol is a problem at many levels of intake. These photos show you children with fetal alcohol syndrome, which is a catastrophic illness that not only has physical ramifications, but many social, emotional, and intellectual ones as well. We also know that alcohol in lesser amounts can cause other birth defects and neurodevelopmental problems. So the recommendation around alcohol is none from the time if the pregnancy is planned, it is planned, till after the baby is delivered. Some other avoids: drugs unless they're improved. A newer one is energy drinks. Don't drink energy drinks. They're too high in some vitamins and caffeine. Drugs of abuse, herbal supplements. We are much more careful about fish during pregnancy because of the contaminants in fish. I always tell pregnant women to check online. There are usually some good guidelines that come out of some government offices about how much you can include weekly. It's a little bit of a catch-22 because pregnant women also need the omega-3s in fish, so you don't want to cut them out completely. Don't go overboard with vitamins, and don't go overboard with caffeine. Caffeine early in pregnancy at high amounts has been associated with miscarriages. Watch food safety carefully. There is a foodborne illness called listeriosis that you get from foods that are cooked meat type products, such as hot dogs and luncheon meats. So many doctors say avoid them or reheat them prior to eating. Pregnant teens have high needs, as all pregnant women do, but also superimposed upon the high needs of teenagers. So these pregnant teens are a risk group. We're moving along to infant feeding. There's so much here, and I'll try to point you into the direction. Please click on all of these links. In class, we would have some discussions about this. So this is such an important period. You are nourishing a rapidly developing human being, but you're also setting the stage for eating habits. We put our children on the wrong course very early in life by things like starting first foods too early, giving sugar too early, putting in little seats and not giving babies tummy time to exercise, leaving them alone when they're eating, propping them up with a bottle. So take a read and read your textbook carefully as well. Of course, nutritional needs of infants are high based upon their body weight, and that is what you see right here. And their macronutrient needs are very, very different from an adult. They need a lot of fat to provide all the calories and to help their nervous system develop. We use growth charts to measure from infants all the way up. And we're looking for a pattern. We're not expecting all babies to grow at the same percentile. Some children will be larger, some children will be smaller, but we don't like to see them fall off the curve dramatically. Please read about breastfeeding in your textbook versus formula feeding. Infants can be kept healthy on either, But I think it's very important that future nurses and dietitians understand that we need to make sure parents, moms, make an informed decision, because there are many, many benefits for breastfeeding for infants and for mothers. Please read over them all. The list is long. Babies tend to stay healthier not only in respect of things like ear infections and asthma, but also obesity, both types of diabetes, heart disease. They tend to have a little bit higher Q. They tend to have a stronger immune system. Lots and lots of benefits here. Benefits for the mother are profound as well. Get back into your healthy weight more quickly, lower chance of diabetes, breast cancer, depression. So read through all of this. Now, it doesn't work for everyone, and that's very important. Very few women cannot breastfeed physiologically. Okay, that's rather rare. Some women don't like it, and some women have to, of course, go back to work and are not able to juggle the commitment required for pumping and storing breast milk. So there's a lot that's going on here. And on one of these slides, I actually have a link to the Drexel's program of lactation consultants, which you would be a perfect fit for with your courses right now. And it might be a great job as you work your way through school. Be sure to read through all of this. And there it is. There is my Drexel link. Go to that and read about the program. Breastfeeding women have high nutrient needs and very often are kept on their prenatal vitamins to cover or at least fill in the gap for those needs. They need to take care of themselves as well, get adequate rest, drink enough fluids, etc. Check out the vitamins and minerals required. And then I'd also say a couple that things that show up on the test. Breastfeeding moms can drink alcohol, but it's recommended after they breastfeed because alcohol is broken down before the next breastfeeding. If a woman goes out on the town and has a couple of drinks, she doesn't need to pump and dump. That's actually a myth. She shouldn't feed the baby at that point in time when her blood alcohol level is high. But if she goes to sleep and wakes up the next morning, her breast milk is fine. We can metabolize about an ounce of pure alcohol per hour. Bottle feeding may be recommended or formula feeding in certain cases, specifically active TB, HIV, AIDS, certain medications that a mom has to take, certain genetic abnormalities, but women who have common illnesses don't have to stop breastfeeding or can start breastfeeding, because one of the best things about breast milk is that it provides the infant with immune factors from the mother. That's something, unfortunately, we cannot get in formula feeding. This is what happens when babies are given a bottle. Sometimes this is called bottle rot, and they bathe their emerging teeth in a carbohydrate-laden fluid. So when you see babies with bottles of juice or Kool-Aid or soda, even formula could possibly do this. That is not good for those emerging teeth. The current recommendations regarding transitioning to whole milk are at 1 to 2 years, the baby can begin or be on whole milk, but it's not appropriate in the first year because of these issues listed. 2 to 5 years, they can transition to a lower fat milk. So breast milk or formula up to the year or first year mark, then whole milk, then lower fat. There is some research emerging that questions whether lower fat is required and whether whole milk could be continued. You can click into that link to read about that research. So we're going to talk a lot about the diets of American children. I will cover most of this in the next 10 or 15 minutes. And we know clearly that American children are short on the healthy foods and consuming too much of the unhealthy. And the problem with this is many, many problems, but they are developing old age chronic health problems at a very young age. If you want to take a peek at the health status of children in Philadelphia, check out the Health Explorer. Spend some time there. I think that's really important for nurses to understand what our population is dealing with. We continue to follow BMI or growth charts. I will tell you this about BMI. The numbers mean different things. So if you decide to use a child as your subject for your homework, be sure to, when you plug the information in the BMI calculator, to also read the interpretation. You can see here that a BMI of 21 for a 10-year-old means overweight, and a BMI of 23 for a 10-year-old means obese. So it's a little bit confusing, but the calculator will tell you this. Needs increase as children grow, but you don't need to memorize that. The first foods that babies need should be introduced between 4 and 6 months. There's no evidence that putting them in earlier does anything good for a baby, and we have a lot of evidence that early first foods increases the risk of childhood obesity, and that's a big problem, so we don't want to do that. 6 months is looking like the direction we're headed. So you'll hear more and more pediatricians say breast milk or formula till 6 months. Babies, as they grow, do need more calories, but then they need more feedings. More formula, more breast milk. For a day or so, you might have a cranky baby, but then if you're breastfeeding, the breast milk will catch up. Your body responds to a supply and demand situation. So besides obesity, here are some other issues with early feeding. This is a pretty nice little link that tells you the signs for babies being ready. It is important that a baby can sit and support their head, and also that they're engaged in feeding. They're swallowing most of what is entering the mouth. This progression is important, I think, in type of food. So certainly 4 to 6 months, food by a spoon. You can start finger foods, and you can see the developmental milestones. The recent advice has gotten a little bit less stringent with regards to the order of foods. We used to say iron fortified cereal, then vegetables, then fruit, then some protein foods, etc. And now we're kind of loosening up a little bit on that. I really like these meals, especially when we get to the kids, because they show you about how much children of these ages eat on the average. So look over these. A lot of different links here. Please look at them. I'll let you read through this. We're going to talk about sweets for sure, not something a baby should be eating. We're going to talk about juice, and I will say the goal is that 1 year, that little fellow or girl is eating a normal, healthy meal of child-sized portions, no choking hazards, cut up. Okay? No choking hazards, and cut up as needed. All right, so this is the fairly new recommendations around juice. People were giving their kids a lot of juice, and we know that these high sugar beverages cause all sorts of problems. We now say no juice before age 1. This is why WIC does not carry baby juice. Babies don't need juice. And only a little tiny half a cup. Measure that out at home to see what it looks like for 1 to 3 and even 4 to 6, and only a tiny cup all the way up through teenagers. Fruit, not juice. Juice is easily overconsumed and can lead to weight gain. Take a look. We got these same patterns here. This is one that I love. In our supersized society, a lot of parents believe that their children need a tremendous amount of food, even their though they're only little people. Read over these menus. There will be a test question that asks you to identify what is appropriate and what is not. A hoagie for an 8-year-old is not appropriate. So we overfeed our children, and now we're paying the price, or actually, they're paying the price. Read over these other issues around feeding children. This is a great little meal, with the only exception, I don't know if those are grapes. I believe so. I would probably cut them up. But here is the philosophy about feeding toddlers and up. Parents' responsibility is to provide healthy food as best as you're able. Child's responsibility is to eat it and then to be able to push it away when they're no longer hungry. So if this little girl sat down to this meal and ate a strawberry, half a slice of cheese, half a piece of whole wheat bread, some nibbles of broccoli, and her little drumstick here, she'd be doing okay, even though she didn't finish everything. So we don't want to become too manipulative around foods, but we do need to provide healthy foods. If this plate had a big old cupcake on it, that's what the child would eat. So it needs to be healthy foods. Read over these. Definitely go into this link as well. And here's that philosophy around eating. More tips for feeding young children. Don't give up. Kids need 5 to 10 exposures. For goodness sake, sometimes adults need 5 to 10 exposures. Sometimes parents throw up their arms and say, my children are so picky, and I say, how about you? Do you eat your vegetables? So don't overwhelm them with 5 new foods, one at a time, small amounts, maybe just nibbles to start. Aha, I added this slide last semester, I believe. This is a problem, okay? Pediasure originally, like Ensure, was meant for critically ill children, okay? Critically ill in the hospital. But of course, like any company, they wanted a bigger consumer base, so they started marketing their product as a grow and gain product. And guess what? It tastes like a milkshake, so kids love it. But guess what? Most of the kids who drink it don't need it, and yet it adjusts their taste buds so they believe that everything needs to be super, super sweet. And now you have a child with even more food issues because they won't eat food and they don't drink drinks that aren't sweet. You're raising them up and fattening them up on milkshakes. Take a look, if you will. Now, it's a vitamin fortified milkshake. Not much fiber in there, by the way. Take a look at the ingredients. You are fattening your child up with sugar. So dietitians and other healthcare providers are really worked up about how widely used this stuff is. Spread the word. Definitely need to watch this video. There is a test question, and that's all I will tell you because you have it. Go into your slides, open the video, play it. Okay, read over this. Great little video on snacks for kids. Kids like to have fun. Things need to taste good. They need to look pretty. There's all sorts of ideas online. I came across this a few semesters ago, and I really, really like it as an educational tool for parents. It's a little hard to remember at first, 5210. Okay, that 5 seems to be out of place, but its meaning is packed. Kids, lifestyle, 5 or more fruits and vegetables, 2 hours or less of screen time, 1 hour more of physical activity, and no sugary drinks. Children, okay, children of all ages and under the age of 2, no screen time. We really are not in a great place with regards to kids, and you'll be the educators of the citizens of this country, so spread the word. We do have a food security problem in this country, and children are certainly, because of their growth and development, very vulnerable. So read through this as well. To counter that, many, many years ago, the government began the school lunch program and the school breakfast program, but these programs have some issues also. This is a great video that looks at the business aspect of the school lunch program. We watch this when we meet together in class, and it's very, very worthwhile. You need to be informed so that you can educate. So take a listen to this and then consider this. We know that very active children usually means they're very healthy, but in some cases they can actually have disorders like hyperactivity disorders. So what about nutrition and hyperactivity? Well, certainly sugar can spike a child's activity. Caffeine can as well. But as far as attention deficit hyperactivity disorders, there have been until recently very few links made to diet, until recently. And recently, and you can read this, we have found a link to some of the food colorings. And some people notice a great improvement in their kids when they take these out of the diet. So that is here. We also need to consider lifestyle, things like sleep, computer time, exercise, because not having enough of this can make behavior worse for kids with attention deficit disorders and other children as well. Children need exercise. They need to be moving around. They need 60 minutes or more a day of physical activity and real huffin' and puffin' type physical activity. A couple of links up here as well. Okay, that was a long one. I hope you hung in there. If not, I hope you came back later, and I hope you're doing well.